So we'll go ahead and call the meeting to order. And our first agenda item, we're going to have to circle back to because it requires a vote, and we don't yet have quorum. So we will move to our next agenda item, which is a budget presentation by Dr. Motti.
Thanks, everyone. So I will be doing a brief presentation just to let the board know what was approved for the FY 23 to 24 budget by the budget division at the City of St. Louis. Please bear with me while I share slides. Can everybody see the slides?
Yes.
Yes.
Okay. So I'll try to make this brief, and the goal of this is just to give you the overall FY 24 budget, but to also focus on some of the key areas of priority. 1 second, please. So this first slide represents I'm so sorry, I'm not able to see the slides on my viewpoint. Just 1 second.
Dr. Motti, while you're getting set up, we do have quorum now. So I'm going to circle back to our first agenda item and ask if we can have a motion to approve the Zoom video as minutes from 8/21.
So move. This is Melissa Tapey.
Can we have a
Second.
Kristen, thank you. All in favor?
Aye.
Aye.
Opposed? Abstentions? Motion carries.
All right, so this first slide represents the actual budget in FY 22. As you can see, we were awarded $27.5 million, just over that. The budgeted amount for FY 23 was nearly $36 million. And the amount for 2024 per the city's annual operating plan is $33.2 million. Last fiscal year, the percentage of professional services to employee services was 58% professional contracts and 42% employee services. In FY 24, the Department of Health is able to utilize the $5 million healthcare trust. This was $5 million worth of money that I was able to negotiate bringing back into the health department. So we are seeing the percentage of professional services to employee services decrease. So that's 47% professional contracts and 53% employee services. This is just to give you an idea of how the FY 24 budget is distributed. So the Director of Health and Hospitals budget accounts for 20% of the budget. The Healthcare Trust now accounts for 15%. So this is a new budget item that you wouldn't have seen previously. Communicable disease control brings in 46% of the budget and accounts for 46% of the budget. Environmental health services, 7%, animal care and control, 5%, and family, community, school health, 6%. So the Director of Health and Hospitals, when you think about the 8 bureaus that we show you in a table of organization, or for those of you who are very familiar with the way we are, if you don't see a discrete area on this pie chart, it's because there are certain bureaus that are folded under the Director of Health and Hospitals budget. These are just historical ways that certain line items are addressed. For those who also don't know, I've said this before, but it's important to note that our overall budget is also 52% represented by grants. So to that end, the Public Health Infrastructure Grant accounts for $612,818 available to use upon contract execution for 5 years. This budget was approved by the state. We're awaiting a contract from the state moving through board bill ordinance processes within the city, and then it'll move through city grant contract approval processes. The focus for that grant is employee engagement, professional development and training, software updates, department level behavioral health education and awareness. Another new grant this year will be the Overdose Data to Action Grant, which accounts for $103,292. This will be year 1 of 5. And this is a budget that was approved through the state that we were able to secure. So if you'll remember historically, one of the strategic reasons why I had that buffer year where the CDC were kind of laying the groundwork for the new organization is because I also needed to raise funds for operational costs for the Bureau. We received 14 salaried positions from the city, but no operational costs to begin. So this was one of the grants that we applied for and were able to get. The focus for this grant will be a literacy program, harm reduction, and other support services related to drug overdose prevention activities within the city. The workforce grant, another new grant, we received $757,191, and this will go through June 2024. The contract was received from the state, board bill and ordinance was approved. This contract is moving through the city contract approval processes. This focus will be emergency preparedness, so staffing support, professional development, equipment upgrades, and advancement. So if you think about some of the real priorities that you've heard me talk about, both at a local and at a national level, is the importance of emergency preparedness after coming out of the COVID-19 pandemic for any future threats that arise. Emergency preparedness also is the main implementation arm currently for any immunizations that we need in the city. Right now, because of poor staffing, we're only able to support COVID, but we subcontract out to FQHCs and specifically to Affinia Health who have our immunization contract. And that's another way that we're able to expand immunizations throughout the city. But this workforce grant is going to help us to strengthen our emergency preparedness team. All right, let's talk a little bit about the main priorities for the budget, for this budget cycle. The Department of Health has worked towards becoming fiscally sound within the city of St. Louis. When I first came, we were down to, at our lowest, 2 accountants and overall 3 people in the Bureau. We now have close to 10 now folks in the fiscal department. We used unpaid salary money and are a year into a contract with an accounting firm to help strengthen fiscal procedures. They have implemented an invoice tracking system. They have helped with training, and they are currently building standard operating procedures and policies that the fiscal department has ever had. It's really changed the way that we do business. We've been getting contracts out earlier. I'll come back and give you actual KPIs to help support that in the future, but we are getting contracts out earlier. We're meeting deadlines internally and externally earlier, and our customer service, which we get a lot of feedback about, has changed dramatically over the last 2 years, from partners being able to understand where they are in process, what delays are, and having staff be proactive instead of reactive and letting them know what's going on. So this continues to be an area of priority for the commissioner and I. And like I said, we have worked to add these necessary positions for fiscal management. Those new positions include an accounting manager and an auditor, full-time, someone who's just looking to make sure that we're in compliance. We, in the new fiscal year 2024, we plan to add staff to assist the contracting process for the department. So this includes 3 contract compliance officers and a contract specialist to continue our goals towards timely fiscal management. We've had 1 contract compliance officer for the entire department of 120 staff and 52% grant funded. It was an untenable and impossible situation, and we thank Carlotta Blair for all her service over these years. But we want to put her and the team in a position to succeed this. So these additional 3 contract compliance officers will go a long way. Another area of priority, as you know, is our new Behavioral Health Bureau that in 2023 to 2022 to 2023, the CDCs that 7 employees helped to establish. In 2023, we started with the first 4 employees. We have now doubled the size of that team with really proactive recruitment and onboarding. So thank you to Dr. Julie Gary, who continues to lead those efforts. We look to increase the work started with the Bureau by creating a training center to educate healthcare workers with the necessary skills to provide behavioral health services to city residents. This work will also include outreach and support to community agencies already working in this space to assist with linkage to care for residents. They are already involved in the distribution of Narcan throughout the city, and they are also currently having folks walk in and call and are linking them to services throughout the city. Serena has been fantastic about providing us with feedback consistently to me directly. And one of the areas we're going to work on is getting you better metrics to show what's going on and be more intentional about really telling the story of what they're doing, because I don't know that that's always visible to folks in the community. The department develops to also continue to strengthen its workforce development and capacity. As you know, hiring in the city has always been a challenge for reasons that you've heard me talk about before. So there are, the commissioner specifically is taking a leadership role in assisting with regular program evaluations, performance monitoring, and establishing and implementing workforce development plans for staff. This will be a big area of priority moving forward. When we look at discrete bureaus, in FY24, the Bureau funding allotment amounts to $5 million through 3 main revenue streams. The state fund that we talked about, the new healthcare trust, and the settlement dollars from the state that went to multiple jurisdictions across the state for behavioral health and overdose work. We have 13 positions that are available for this. And we currently have, and I don't want to lie, so I'm thinking about this, 1, 2, 3, 4, 5, 6, 8 to 9 staff that have already been onboarded and are currently in the department. A lot of those, that doubling of number has happened within the last few weeks. So we're really giving them time to focus on onboarding and really developing the culture within this new bureau. Positions from this bureau are expected to be funded through the healthcare trust previously discussed. And like I said, 8 positions are currently filled. Environmental health services, goals for the fiscal year in 2024 include upgrading the food and beverages program's electronic record keeping to include all new establishments and at least 25% of existing establishments. This is the continued goal of updating the department from being completely paper when I came. And so we have moved into online, on a more online services, and this will be another area where we're advancing that work. There's ongoing ask of the public for the department to accept electronic payments. The Bureau's goal is to add this feature to food permit applications during this fiscal year as well. And the Bureau also wishes to procure additional vehicles for the use of its staff, which perform field work daily throughout the city. For animal care and control, the division's goals for this fiscal year include modernizing and expanding its aging animal control vehicle fleet. It also plans to increase training for existing and new staff to ensure their safety while attending to animals in the city. We've more than tripled the number of animal care and control officers still since I started. So this is a really positive advancement, and with it needs more support for them to actually get around and do what they do. So the fleet part of it, we've very aging vehicles, not safe for both them and animals. And so this has been an area of priority, and we've already had some successful meetings with city leadership to advance this. Animal care and control also wishes to identify a facility larger than its current location to house animal shelter operations. And we have had meetings as recent as this week to try to advocate for that at the city level. The communicable disease section continues to advance its tuberculosis services clinical work. This is one of the only clinical services that the health department still has. Most of the clinical work of the health department was ended about a decade ago. And this is something the commissioner and I continue to try to raise as a priority at the city level, but will require much more extensive support at the budget level. So we continue to have those conversations with leadership. The refugee health program is housed under the tuberculosis services clinical work. The program recently saw the hiring of a new nursing supervisor to guide its work and outreach into the community. The Bureau also plans to connect with residents and community members through outreach and awareness programs that include the prevention of an array of communicable disease transmission. It also expects to expand its capability for additional communicable disease investigations. So trying to get back to pre-COVID work. And we lost a lot of staffs, particularly in this, because this was kind of COVID central for case investigations and outreach, and caused a lot of burnout across the country. And so this will be a big area of rebuilding. We also obviously need to continue to shout out our Health Stop and the Ending the HIV Epidemic programs, which is one of our most visible and successful programs. They've come to present here. We'll invite them at future board meetings as well. New website, new social media platforms, increased outreach for at-home HIV test and outreach significantly, and probably leading the department in doing so. So that is really a shining star of the Communicable Disease Bureau, and we thank them for their service. Last but not least is our family community school health. The goals for fiscal 25-24 include to help partnerships around childhood obesity and postnatal services through additional collaborations with community partners. They also plan to increase community outreach participation. The Bureau is also expected to assist with internal education for DOH staff on CPR and first aid. Maternal child health is another one of the two main programmatic priorities for me and the commissioner in FY24. So recently, as last week, meetings that I've had with the mayor's office were successful in advocating for an additional $500,000 to be reallocated from ARPA funding that was sent elsewhere previously, that it will now be earmarked for prioritizing maternal child health. As you know, we also have an RFP for community health workers that is ongoing, and they will be prioritized for this work too. And that work and the community outreach work is going to be massively increased in scope, and by the 2 mobile vans that we now have that are wrapped, you will have seen if you're following our socials, are at community events on weekend. So we are quite literally bringing education and public health to people. Last but not least, we are starting to go in person to Board of Aldermen meetings across the city. Our plan is to make it to at least one of each of them each month. I was at the first for Alderwoman Shamim Hubbard Clark, where we talked about Medicaid expansion and COVID and other things. They were community members that were able to ask questions. We hope to expand the scope of these by making sure there also is a Zoom link where other folks in the community can attend, ask questions, and engage both virtually and in person. But we're trying to meet people where they are in person. So the behavioral health team and myself will be going to each ward, and you will see more on that soon. When we do those, we will have our mobile vans with us to also provide services in person, to provide things like Narcan, education in person. So this is like a big expansion. We really want to pride ourselves in being the leaders in innovative public health community-based services this year and in the years moving forward. I'm going to stop there and open it up for discussion and questions. Thank you so much. And thank you to Kim Vanderberg, who prepared these slides for today.
Okay, thanks, Dr. Marty. I saw a comment in the chat. I don't know if you were able to see it, but I think that's a good idea. If you have the schedule available in advance, that you can share so that board members who are also available can attend as well.
Great idea, Dr. Bradley. As soon as we start getting those in advance, we will send them to the board as well. And I can have them included proactively in the monthly report that I know you all read in great detail. And you know, if you do read them, that at the end, there's an events to come section. So we will make sure those are included, but just to highlight it more, we'll also include it in the body of that summary email, the beginning part, so that you kind of know what the highlights are. It's a fantastic idea. Thank you for suggesting. Especially with new board members coming, I think it'll be a great way to get them engaged as well as these progress.
Are there other questions or suggestions? Kristen, I see your hand up.
Going back to the workforce development budget for next year, is there, and I know you've talked about this before, but is there like intentional increase in like employee wellness and salary adjustments, or is that like I know that's not going to be a fast transition, but just of course, knowing the workforce and the burnout that I feel like is spanning across a lot of healthcare spaces, thinking about strategies to make sure employees feel seen and have agency as they onboard.
As always, you are spot on. The difficulty is that individual departments don't have individual agency over salary. Salaries are standardly set across the city. The mayor last year was able to increase salary across the board for all city employees, 3% above the annual 1.5% increase that all salaried folks get. So they saw a 4.5 increase, 3% above what they usually receive. The same was instituted this year. So over the last 2 years, there's been a 6% increase above the 1.5% that you've seen total. You know, there's still a ways to go because in doing, you know, research across the different positions, we're still woefully lower than some of the national and certainly the regional comparisons for salary. But, you know, kudos to the mayor for being one of the first mayors to make an intentional effort there. Even if I had like discrete grants or the desire to do so individually, I am not able to do so because that's controlled through basically our human resources, which is the Department of Personnel for all salaried for equity reasons and for standardization. So that's been one of the main areas that is difficult. We're going to have a discussion about adjusting the charter. And one of the things that blew my mind when I first joined the city is that there's also some policies that are established at the city level that make it difficult to work on wellness and incentivization. So you can't just buy lunches and take people out for lunch. Well, even if you have a stack of money left over in the year, I do employee spotlights, as you see in our monthly reports. And I wanted to do an honorary or stipend or, you know, like award, $500 to whoever gets it each month, because again, in looking at my budget, we have that, but that's not allowed through existing city policy. There is a new director of personnel who's very innovative and I know wants to work with us to increase all of staff wellness. And this is a continued conversation that we bring to City Hall and the mayor's office. So we're limited in what we can do. I'm very big on doing what I can. So we're very intentional about increasing staff meetings, section meetings, visibility, pop-ups, walk-in, the discrete amounts of monies we do have that are not constrained around being able to do obvious and very intentional things we have been creative about. changing the office climate is a big project this year. So there's been construction and they get autonomy and they've worked as groups within their bureaus to talk about, things that they'd like, new paint. We'd like to get some artwork within. And office parties. We'd never had a Christmas party before I came. We now have one, and there's dancing, there's music, there's soul food. There's I don't know what it's called because I'm not from this country, child, but it's like Secret Santa, but it's like pass it along, but it's a game. And you
What is it, White Elephant or something?
That's the one, White Elephant. That's what it's called. So, we do what we can. But there's systemic and structural issues that have to be addressed. And my hope is that through charter reform, we'll be able to get there, because recruitment is one thing. In my first year, I hired 62 people, but we lost 47. And in implementing the first standardized exit interviews, I now have data to look at what it is. And it's certainly salary 1, 2, 3, 4, and 5. And then workforce burnout, and being able to get additional benefits at other jobs that we just don't have. These are the challenges that are more systemic and structural.
Thank you. And kudos, because getting a 6% increase over 2 years isn't easy in most systemic areas. So congratulations on that.
To the mayor, yes, congratulations to the mayor, and thank you for her leadership there, definitely.
Okay. Other questions?
It's not a discrete budget item, but I just have to highlight that another huge area that's been 4 years in the making is this is the year that we will be formally applying for reaccreditation. This is a burden of love and labor for Rhonda Bartow, who has led these efforts mostly alone. She has come here, you have heard her speak, you have seen the quality of her preparations and work. Shantae has joined her in the last year for 2 people to really, now with the support of the commissioner, bringing some leadership support there to really guide a regional approach in partnership with the county for reaccreditation is just exemplary. So it's not a discrete budget item, but I would be remiss without saying that that's literally within the top 3 priorities. And for me, right now is number 1 is supporting Rhonda, Shantae, the commissioner, and the rest of the people supporting them, Craig Schmidt being another, in getting us across the finish line for reaccreditation this year. Rhonda is literally a month away from final submissions. So please send her all love and support. And if she needs any additional help, we're trying to get that to her in a timely fashion. Other questions around the budget, comments, things that you didn't see that I should be working on, or feedback?
Yeah, I was going to say, I see Dr. Bradley's hand is up.
Hey, yes. Hey, Serena, by the way, I didn't get to greet you this morning, and to everyone else, good morning. So a couple of thoughts showing up, and we'll just rattle them off. I'm curious about how the budget's developed. Is what you received? Obviously, I just know that just a good director would never ask for and get what they asked for. So I'm sure you asked for more. What did we lose with this allocation? What did we if we gained anything? I'm curious about that, because I see that we were 35 and then we went to 33. So did something get fixed and we didn't need $2 million or something, or what happened there?
Yeah.
Curious about the healthcare trust, if you can tell me a little bit more about that. And healthcare trust does what? And you say that it's back to the health department. Where did it come from? Let me just start there.
Great questions. So the way the budget is developed is starting around end of September, beginning of October. So very soon we start to get some formal document. Well, no, we don't. We internally as a department, I started earlier the budget process because there wasn't a lot of time dedicated to support bureau chiefs who are not fiscal content experts, in really giving them time to meet with both the fiscal department, to meet with 7 other bureaus. And at the time, there were only 3 people doing this work, and Emmanuel is the manager who meets with everyone. It didn't put us in a position to succeed. So before I came, I felt like it was a rushed process, because the budget division sends out the paperwork and the instructions in the beginning of December or so. And then the final budget has to be submitted at the middle of January. That's a 6-week period. So that doesn't put a burnt out people working 3 jobs all at once department in a good position if you wait until you get the budget division's formal email. So since we know when it's coming every year, one thing I implemented when I first came is starting that procedure with infrastructural standardized process in the end of September, beginning of October. So that allows Emmanuel to basically send internal standardized spreadsheets that give them, the prior 2 years and help them to start looking at discrete areas. They then also have discrete 2-hour meetings with me and the commissioner, the bureau chiefs, to talk about the qualitative side of it. What are your actual priorities? What are things that we need to grow so that we can make what is a very sort of numbers fiscal document reflect our priorities? That's the simple way of describing it. So October, November, 2 months of these like internal meetings and pre-prep work. December, the formal documents come from budget. We then work together. We submit a budget process in January. We don't hear anything from budget. I can only speak to last year. The budget division then works on what they need to do to prepare. In April, we get a 1-hour meeting where there are questions asked of why we did certain things or errors they caught or discussions about to clarify. After that 1-hour meeting, this year, I then got the budget.
A 1-hour meeting, you said, okay.
Yes, with the budget division and members of the mayor's office.
Okay.
This year, I then, they then finalize the budget, and then this year I got the budget, I want to say in June. And because then you have to present the budget to the Board of Aldermen for it to get approved for the next year's cycle. So I got the final budget on the Friday, 3 days before that budget presentation, and you are expected to come and sort of talk about, it wasn't June, it was May. So it was in May. So we have that meeting in around April. May is the formal budget presentation. So May 17th, we met with the Board of Aldermen. We were called back May 24th. So we got that budget about 3 days before the formal live streamed aldermanic question around what did we ask for, what did we get, and what would we have liked to see. But at that time, from my understanding, the Board of Aldermen is not able to make a lot of changes. They can't increase the budget, but they can advocate for changes where necessary. I would need to have someone with more formal understanding of that process to fact check it, but that's what we are advised. So after that meeting, it then goes through board bills and formal finalization of the budget. And then we receive the FY24 budget starting July 1st. So that is the process within the city. The Healthcare Trust, over the past 10 years, in order to help support regional Medicaid expansion, there was $5 million a year that was awarded to the Regional Health Commission to do this work. Once that work ended, that money could have been sent anywhere in the city. So I spent time advocating. Even though the contract was up the year that I came in 2021, they advocated to me, because it's not just like a light switch, like most things, to please extend by a year to allow for them to really have a formal off-ramp. So we supported them for an extra year. And then I advocated through the city to ensure that once that trust that is through taxpayers' dollars and the city formal budget ended, that would remain within the Department of Health, anticipating that the budget was likely we were not going to get everything received. So the last part of the question is, did we get everything we asked for? No. We wanted to add a whole division around quality improvement and workforce development. That entire bureau was not approved. Other salaried positions were not. And, they had to make discrete budget cuts across line items that we had as well in order to support the city's budget. So we account for less than 1% of the city's budget currently.
All right. Dr. Bradley, did that answer your questions?
I feel like throwing a fit. I'm pouty, but I know we on YouTube. So I won't pout. The other thing is there a tradition of disseminating budget information to community partners and opening this up more transparently for our community partners?
There is not. And health literacy is a big issue. I discreetly, any of you who've heard me speak, the Missouri is 50th out of 50th in public health spending. The Missouri spends $7 per capita on public health. My department is less than 1% of the city's budget currently is not a new thing. That is something I speak about everywhere. But I think Dr. Bradley is very correct in saying that we need a more strategic approach to increasing health literacy and specifically the budget. An easy way to defend the health department not having a much higher percent of the city's budget, and there's a lot of global academic and WHO has defined recommendations that thriving cities with thriving economies should at least think about, supporting 5% of whatever the city's budget is towards health and public health. That is constant, that is standardized and known. I think that we have a health literacy problem, not only within community, but with leadership.
Yes.
At the highest level, politically, nationally, and across the board. So this disinvestment in public health is a global, federal, state, and local issue. And it does not empower us to get to where we need to go. So I do think that a big part of this is to increase health literacy, to make sure that especially those that are the most disenfranchised and vulnerable amongst us are really told what the budget is and the budget process and the same questions that you're asking in a way that they can receive. And that hopefully that will increase their understanding, their participation in the work of the health department, and their advocacy for growth moving forward.
Beautiful.
Is that what you were getting at, Dr.
Yes, you did that. Thank you. Yes, and more to come as we think about that some more. Thank you. Absolutely.
Other questions or comments? So I will say a few years ago, it might be more than a few now, because it was prior to the pandemic, the health department had a communications initiative to focus on improving health literacy for that very purpose. And there was a survey done to see if people understood what the health department does and what the impact of budget is on health department services. I don't know if any of that information is still relevant, like if things have shifted since that time, but it might be a good starting point to think about how we have communicated about what the health department does and why it's important, and the budget implications for the Community Engagement Committee, which I think will meet in October. We're very close to finding a date.
Period. Yes. I'm so excited because if Dr. Madi even recalls that this was a part of some of the work that we did as part of the health equity strategy, and thinking about how to found and root health equity throughout Department of Health work and therefore, within the city. And that was one of the big pieces that we wanted to strengthen the capacity of community partners and residents to understand what it is, how to build advocacy around that. So, if that data exists, it would be cool to even kind of pick through that and see where we can pick off from there. But I'm so excited to hear that. Thank you, Serena.
All right. Dr. Madi, you're up again with our next agenda item, departmental updates.
I'm actually not going to do a formal presentation for departmental updates this month because I think we did a lot of discussion around the board. So I'll just quickly show you that, we do our work here, and there will be slides, coming your way. We unfortunately have an acute absence for the person who is responsible for getting this report out. So you will either receive just like a protracted version. You're usually used to getting the PDF PowerPoint version as well as a long narrative. I can assure you that you can get the PowerPoint version, but as for the narrative, that may be sometime next week following, just so that we can allow people to heal and have time when they need it and to support them as such. So that will just be one little difference this month. What can you expect to see? A lot of congratulatory, a lot of, it's important to highlight the amazing work that bureaus are doing. So already the Behavioral Health Bureau is getting awards throughout the city. Tammy McNeil, who's been with the health department for many, many years, previously in refugee health, and has transitioned to a significant role within the new bureau, being awarded by Better Family Health in the Making a World of Difference Award, and Dr. Julie Gary also receiving this award with her. So congratulations to them. One of the other main things that we're going to highlight that we'd like you to really disseminate as you are actively recruiting for us, because we send you in the monthly report that you get and always read all of the job openings with easy links for people to put in the amazing emails that I know you send to your networks on our behalf. Please add this big change, the lifting of the residency requirement. So this is a huge win for the mayor and the mayor's office and her leadership, in that through her advocacy at the state level, we were able to get the governor to assist with lifting the residency requirement for work. So one of the things that's also limited, besides salary, my ability to recruit and keep people in the city, is that you have to live within the city of St. Louis. So anyone who lives in the county, within 45 minutes in Illinois, or they can even get to my health department within 20 minutes for some people who live in Illinois, still can't work here if they don't have a permanent residence within the city. That was lifted. So we're able to really expand the net of who we can employ within the region. So we need you to really shout this loud and proud wherever you are, and continue to send the very easy copy and paste available job openings. I'm also going to be coming to board for some higher level positions that require some really intentional recruiting moving forward as well. So we have some supervisor positions that we drastically need. But shout out the fact that we advocated in last year's budget, and I was even live for a receptionist, and we have a receptionist for the first time in the department's history, y'all. So I know that sounds silly, but we were having to make administrative support patchwork people. It wasn't helping with customer service. People didn't know how to reach us. We have one receptionist, one script, one way to link. I mean, it sounds silly, but it's huge. So lifting of the residence requirement, please get the word out. COVID numbers are up significantly in the city. Look at some of these percentages: 139% increase in a month, 134% increase in a month. You all know people who have COVID, I'm sure. My phone is blowing up with people surprised that they have it and asking for my advice. So pay attention to this, and we will have a respiratory virus area in addition to COVID throughout the winter, because there are 20, you're both blessed and cursed in having an ID doc as your director for health, because this is something I know intimately. So there are 40 other respiratory viruses, but the 3 ones we'll be paying attention for in the winter are RSV, record season last year, highest numbers we'd seen in 10 years, flu, record season last year, highest numbers we'd seen in 15 years, and then COVID, which is up right now. All of them respiratory viruses, so a lot of ways we can get sick. We continue to advise masking if you're indoors, especially if you're high risk. Who is high risk? People above the age of 65 and those who are immunocompromised. Social distance, don't be on top of people. Stay home if you're sick. Don't be that guy that comes to work and makes everybody else sick. Hand wash as well. The new booster was approved through ACIP. The state is working on a new program. We won't be able to just give it at will, because the emergency order means that there's less congressional money to support COVID in general. So there's a bridge access program that I'll tell you about more later in the year, where select health departments and FQHCs only will be getting discrete doses of this new booster to only for folks who are uninsured. So this is a very specific populations now. Other folks will need to contact their insurance providers if they want COVID-19 boosters moving forward. And the application to the state for that bridge access program was submitted from our health department yesterday. We will not know until they get back to us if we're even going to be awarded this, and our health department can disseminate COVID-19 boosters. But other FQHCs have also made a similar application, and will have the new booster at hand to disseminate. Pretty maps for you. Every bureau report will be here as well, so you will have that. And as always, please pay special attention to the current job openings. There are discrete links in both the narrative and this version that you can just copy and paste into an email, and also say you don't have to live in the city anymore. So please encourage folks to apply. This is the section. And then per Dr. Bradley's suggestion, we will add when we are at in-person Board of Aldermen meetings to this section, which is upcoming events. And you can see the ones for September and October here as well. I will stop here if there's any questions.
Questions? So I have a question about the recruitment. I believe that we've done some in-person job fairs. I've been working with a lot of young people who don't have employment history. And when I point them to a link, they're not getting very far filling things out online. I don't know if the in-person format, the job fair format, has been helpful in recruiting folks who have limited work history, or if you've seen any difference in your recruitment strategies.
So once I joined the health department, I created a position that Michelle Turner now occupies for a person who just focuses on personnel. That is liaising to move things through faster through Department of Personnel. If you remember, one of the other statistics you got tired of hearing me say is from job posting to someone walking in on average took 6 months before I came. We have had that now since I joined the health department, and Michelle Turner's and this creating that new position is a big reason why. The other side of what she does is we partner with the Slate division. They are responsible for job fairs in the city, but they also have paid internship for young people up through the age of like upper 20s, where you can sort of be supported by them in developing a CV, interviewing, paid internships in departments that you're interested in that can help overcome this barrier that you're talking about. And so, for example, we had a young man that we met at a job fair that was Slate, and Michelle goes to a lot of job fairs with Slate now. There's a job fair coming up in City Hall on October 7th. We'll make sure that you have a flyer with the report because that would be a good way for the board to also show up for us. Let me tell you about Kimberly frickin' Vandenberg. I'm just talking casually. Kim is dropping dimes in the chat for you, making life easy. Kim is up here putting job fair flyers as I'm speaking. Find me a supervisor in the land for our new communications bureau who is this efficient. I mean, come on, y'all. I have the best team in the land. Just let me flex for a minute. Like, who is even Kim? Look at your chat right now. I say something and within seconds, Kim's got a link. I just said the job fair. Here it is for y'all. So this is the flyer. We'll also attach it. But these are the types of job fairs we are now able to support with intention, Serena, because of Michelle's position in the strategic support. Last year, we also did 2 virtual job fairs. We'll be bringing those back too in the beginning of next year. But there are now in-person job fairs, virtual job fairs. The monthly report provides now close to 500 partners with the links to other job opportunities. And our social media has a defined day every week. Yesterday was it, where they post. You've seen the flyers, hopefully, if you're following us on social media, the jobs and easy links on how to get them. So we've had a strategic approach, and I think that's helped me break records in hiring in the city. But we need more. And again, I love the feedback that young people don't make those minimum requirements. We call them the Department of Personnel sets. So I think a creative way is to really work. If you email me, like if they email the places that we give you in the report, Michelle Turner, I'll make sure that we give you her email address, can be a direct person that they can talk to within the department to work on these strategic partnerships with Slate to get young people in who may have less experience. I can't promise that I can get everyone a job because the city is like anywhere else and they have minimum requirements across the board. But like I said, we've been able to really overcome those systemic and structural hurdles that sometimes screen people out without consideration for multiple positions since I've been here, as long as they come to us directly. Does that help?
That's very helpful. I think for me, it's more clear that instead of, sharing the link is the right thing to do for certain candidates, but if I'm working with someone that I know may have some of those barriers, to look for the job fairs, to connect them to Michelle, to take more routes than just saying, go to the website. So that's very helpful. Thanks.
That's right. And Mbal is saying now that you can recruit from other workforce centers, that's the biggest part. We really need to expand our visibility. So we even partnered with St. Louis's County's job fair, right? People don't just, traditionally used to seeing us partner with the county all the time, but we have had 6 joint policies since I asked them to meet with me monthly and now quarterly. We are going to their job fairs because we can get people who live in the county now. So I think it's just getting word of mouth and making sure people really understand that the lifting of the city requirement is a big barrier. So thank you for that comment, Mbal. And yes, the director of Slate is probably one of the coldest directors in the city. Frederica McGowan comes with years of experience, passion. She loves young people. She mentors and sponsors them. She uses grant money to support all of these trainings, job fairs, but it's really mentorship and sponsorship for young people to make sure that they can get the jobs they want through CV, interviewing skills, and again, direct contact. So for example, she'll hear about a young person, she'll ask them to send their CV. She'll email me directly and say, we found this intern. Do you think you can find a place for them? I link them with Michelle. And I'm telling you that we've hired at least 10 people now through direct partnership with Slate.
Fantastic. Other questions? If not, we can.
I did have just a little thought that I had. Dr. Mati, is it possible kind of connecting the conversation around the budget and what we did get, what we didn't get? Is it possible that areas that were like funded adequately or we got new funding, is there like a cross-departmental kind of synergies? Like if we got a boost in animal and health, animal care or something like that, would the capacity they have benefit another area department that may not have been met?
Yeah, so the city is very strict about a line item is a line item is a line item. So even if one department spends 1 cent and then they're like, oh, my other bureau, I would like to bless you with the $50,000 I wasn't able to spend. There are very strict rules around just transferring dollars, and it causes a lot of havoc, understandably, for the budget division. So the budget discreetly doesn't really empower us, but the reason why we wanted a QI is that because of the leadership of, again, Rhonda Bartow, QI, and our EPI division, a lot of quality improvement projects have happened, and we can do some presentations that are intentionally designed to have folks from different departments work together to start projects. So there's 6 discrete projects I've presented here previously. Those were all interdepartmental. Our executive leadership meetings, I've changed the format so that they can hear what other departments are. And through their own leadership, the bureau chiefs now have a meeting outside of me. I like to pray that it's not forget that crazy lady, we can't stand her leadership, so we're here to have a support group. But it's also ways that they're giving each other, they each have different strengths and weaknesses. So they're supporting each other, venting, and they're also exchanging information. So I've seen way more inter-bureau collaborations from a programmatic perspective, but there aren't a lot of flexibility for once you have been told this is a discrete line item, you can't just shift and change dollars easily.
Okay. So I think we can transition to our last set of agenda items. Thank you, Dr. Mati. Basically the committee updates. And because Tim is not here, we're going to skip the academic partnerships update and go straight to our governance and nominating committee discussion. And we actually have, as a part of this discussion, the charter conversation. So let me see, do I see Linda? I see Linda just unmuted. I'll turn it over to you.
Hi, thanks very much, Serena. So thank you very much to several of you who have submitted names for consideration for our upcoming vacancies on the board. We have, I believe, 6, and if I'm not mistaken, 7 vacancies that need to be filled in beginning in February 2024. We will work hard to have a slate of nominees present for you to vote on either in October or November. So all that is coming in, but please send your nominations if you have not done so already, if you know of someone who would be a good fit. So, I mean, that's really our main chunk of business right now, is filling a large number of slots. And I think whatever time we have left, we should certainly spend on the charter, however Dr. Maddie and Serena would like to proceed.
Okay, thanks, Linda. So let's see, I know we've discussed it as a board before. I don't know if this composition has seen all of the recommendations around the charter. So it might be helpful to just talk about what's in, what the Governance and Nominating Committee has developed for their recommendations on charter improvements. And I'll see if I think I'll have a document I can share.
I unfortunately am being called away emergently, so I apologize. Craig, are you still on the call? Craig could help facilitate this discussion. So Craig, if we could focus on how many minutes would you like this to be, Serena? 5, 10?
We have about 15 minutes.
Okay, so 10 to 15-minute discussion and leave 5 minutes at the end for questions. If you could focus on just a brief presentation of the email and share screen of the previous recommendations through the Board of Health. And if you could just concisely talk about some of the recommendations that are also already coming in primarily from you and Rhonda, of some examples of other areas that are not specific to just the health and hospitals that you both identified, and then open it up for questions. Like I said, I do need to get this to the mayor's office next week. So the last thing that I will ask is that Craig puts his email in the chat. And if anyone, after reviewing our section of the charter or any other parts of the charter, just has bullet point style, hey, please send them this to look at or change, or I've known that this has been an area that I'm passionate about, you send that directly to Craig by end of day Monday. And then we are compiling all of the things. So I have to drop off, I apologize, but Craig, is that okay for you to take leadership of?
I am okay. If Serena, do you have that document?
Yes.
Great, that's terrific. We're ready then. And of course, Linda Racklin and her team on the governing committee have already worked extensively going back to 2021, right, Linda?
Yes.
So it's really not that complicated. But I will tell you, in addition to all of this, you know, when we think about all of the sort of barriers that Dr. Mahdi has talked about and the Commissioner Anwari have talked about, and a host of other people in the past, you know, moving monies around, how we accept grants, how we do contracts, all of those things could be massively impacted by changes in the charter, including how we, you know, this is like our Constitution. And so we could do a host of things, Dr. Bradley and others, with regard to equity and really set that forth. So, and Linda may want to talk through, obviously, what she presented earlier. I saw it flash up a second, Serena.
I had it up and then I think I had the wrong one. So I'm going to do a different one.
Yeah, no, that was the right one. That was her memo, I think.
Yeah, that was my memo. I
Yeah.
don't know if that's the
You
document
wanted
you're
to
talking
share?
about.
I
Okay.
think that's good. Yeah, right, Linda, because that kind of briefly
Yeah,
talks about
well, the
what you
charter
were-
hasn't changed, so that's.
Right.
So here's why I took it down. I noticed in the header, the first thing says not for distribution.
Yeah, but it is for this distribution, I think.
Okay, all right.
Right, Linda? You're good.
Yes, yeah,
Okay.
sure. It's a draft, you know, it's a working document of the governance committee. So I think as long as it's presented that way, then I think we're okay with it.
All right,
It's not prepared right now to be submitted to the mayor's office. But it's a draft, so.
all
I
right.
mean, I could just say a little bit about
Yeah,
this, this,
please.
this memo is kind of long, as I recall, and it might be hard to share in a screen sharing format. I guess in a nutshell, the city charter is the founding document for the city that sets the parameters and the responsibilities of all those members of city government. It's what gives the mayor and the board of aldermen and each of the city departments their authority to, govern the city. And so in that sense, it is, as Craig said, our constitution. The issues that we have are that in this document called the charter, we are referred to throughout the document as the Board of Hospitals and the Board of Health. And of course, this document was written quite some time ago when the city of St. Louis did have a number of public hospitals, and now we no longer have any. So we do not, we're still called under the charter, the Board of Health and Hospitals, but there's a Board of Hospitals and there's a Board of Health, and then we serve together. But well, it makes no sense because we're not a Board of Hospitals. We are the Board of Health. And so the changes that we'd like to see, at least as a threshold matter, are updating the charter to reflect the fact that, we don't have a hospital oversight function going on at the department. We don't review hospital actions or hospital operations and anything like that. So references to that kind of oversight responsibility need to be removed from the document, as does the reference to us as a board of hospitals. So most of these recommendations are really just making that change in the charter, saying, removing the language about Board of Hospitals and putting the focus squarely on the Board of Health. So, I think you could probably circulate this memo and it may be easier for people to digest in that format. What this document does not do is go through and talk about incorporating equity and other public health measures into the charter, if that is something that we would like to do at this time. So I think it really depends on Dr. Maddie and the mayor's staff to along with our board input to decide how we want to make any of those kinds of substantive changes in the charter. What has to be factored into that decision is whether what we might recommend would be approved by the Board of Aldermen. So the technical process for changing the charter is that we work with the mayor's office to come up with a proposal. The mayor then supports those changes, brings them to the Board of Aldermen, and we have to have a board bill passed by the Board of Aldermen. Then that board bill has to be submitted to the city population in a public vote on an election day as an item in the on the ballot to change the city charter. So there is an effort that is going on right now to update the charter in several ways. So this is sort of a window and an opportunity for us to be part of those changes that will take place.
So just one clarifying question. With this charter committee, are we still saying that we would need to have a separate request? Because it sounds like with the charter committee, we're just making our recommendations to them, and there's going to be one set of recommendations that the Board of Aldermen votes on. Is that accurate?
Linda, yeah. So the director has asked us for input because as a member of the mayor's cabinet, as a director of health and hospitals. She's been requested to bring forward suggestions on charter changes to the mayor's office. And so all of the directors and so forth will be doing that. But there are opportunities by the public also to bring forward suggestions directly to that commission. But as a member of the mayor's cabinet, it's going through the mayor's office, or the suggestions directly from the departments. So that charter commission meets every first Wednesday at 4:30, beginning at 4:30 at 1520 Market, which is where the health department is, downstairs in the large room. So when you come in the front door, you hang to your right, and it's in that area. But they're also talking about meeting out in the neighborhoods and so forth. I really don't know how many meetings they will have, but they recognize that parking is at a premium, particularly since we now have the championship soccer team downtown, and it's only a brief walk from the health department. So they do want to get out into the community as well. But as Linda pointed out, this is a real opportunity for us to hitch to the wagon that's it only teams up once every 100 years or so. So this is a great opportunity to really make a difference, I think.
Okay, so Craig, Dr. Marty mentioned that the Department of Health staff also have some recommendations. Did you want to?
So we're gonna, she's gonna be looking for those to try to get those by tomorrow. I think there'll be other opportunities as well. I think a lot of it is to really sort of think outside of the box, right? So for instance, the health department is listed in I think it's Article Roman 13, Section 14C, along with it's listed under 14 with the Department of Welfare, which is basically now the Department of Human Services, Forestry, Parks and Forestry. Some departments are not even named. It's under the Board of Public Service. That's the section that it is. So there's any number of things that could be changed so that the city operates as a city. There's likely to be a lot of political intrigue because, as you well know, this city is run by a triumvirate of the mayor, president of the board of aldermen, and the comptroller. And that will probably remain the same, but there may be ways of operationally doing things different. We could have a manager form of government. We could have different ways for legislation to be presented. There are initiative petition manners for the city, but there's a whole host of things where we could be working together. The director, I believe the commissioner as well, and others have talked about how can we work more closely with corrections, for instance, and corrections isn't even listed in the charter as I see it. In terms of mental health, physical health, all those sorts of things. You all talked about employee wellness. Well, it seems to me that public health should really be part of that, and others may think that's also the case. Do we have health impact sort of statements along with fiscal impact statements that might be part of our legislative process? Might we eliminate the need to go through a PSA, Board of Aldermen, Board of ENA, and a whole host of other groups and just put it down to one group that represents the entire city at one time? Should we have one grants office? Should we have one operational office as opposed to the Board of Public Service that may or may not include others? So we really, I think, are looking at ways that this board and employees and people in the community might suggest ways that we could be more efficient as a government, more transparent as a government, and really make a difference with greater impact and have greater flexibility. As Serena knows, we have very little nimbleness, even though, directors like Dr. Mahdi and the commissioner work on that every day.
Thanks, Craig. So I put in the chat the two recommendations that have currently been put forth by the Governance and Nominating Committee. And it would be helpful for folks to just know what we're proposing. And because not everyone that is currently on the board was a part of those conversations, if you have questions and concerns about those two items specifically, then this is a good opportunity to raise those. Otherwise, we will advance those two specific recommendations to Dr. Mahdi to be included in what the department develops. So that's the first thing, is just either endorsing or asking questions about the two that are in the chat. The second is there's a broader conversation that's happening with the staff who know more about the internal operations and what needs to be addressed through the charter. And I'm not sure that the board can necessarily weigh in on all of that, but we should also discuss a mechanism so that when the staff does get to the place where they have their final set of recommendations, we have the opportunity to offer some input, feedback, or support as they're developing that. Because I don't know that we can do all of that now in this meeting. So I will ask for folks to weigh in on the first two recommendations that have already been developed. Any questions or concerns about those? If not, are folks comfortable moving them forward? And a verbal response or a thumbs up or something would be helpful, just so I know. Thanks. See Colleen, Kristen, thank you. Melissa, thank you. Corey, thank you. Imbal, thank you. All right. And then as far as ongoing feedback, Craig, did you say that the staff team is supposed to have a draft by next week?
Dr. Mahdi asked for us to present her with some items that have been requested from her. So she asked us to do that by tomorrow. I have not seen any of those. And yeah, so I don't know what those are likely to be. But you've heard a lot of those kind of outlined. If we dig deeper, there's so many things that we just sort of naturally assume because it's in our Constitution, it's in our charter. But if we really dig deeper, a lot of times it's based in the charter, but then the ordinances that come out of that.
Yeah. So I think what I would probably suggest what I'll suggest as a next step is, once Dr. Mahdi gets the list from staff, she did contact me about whether or not we would need to have a meeting specifically about that. So once she sees the list, if she feels like there's a need for more board input, then we can send out the information to the board and receive input or feedback that way. There's no time for us to really have a formal meeting or process because all of this is due by next Friday. But I think just making sure that folks are aware of what the recommendations might be going forward and have the ability to weigh in before it's formally submitted next Friday is going to be important.
Irina, the good news is that the commission is really finding its way. As you might expect, nobody has ever gone through this. The last time was 1916, I believe. So there's nobody alive, probably. There might be one person, but nobody really remembers how this is done. And so they're all finding their way. And I think there'll be ample opportunities. I'm not clear on how long they'll be doing this. I suspect, at least through the beginning of next year. So there'll be opportunities.
All right. Any other questions or feedback on this item?
I just wanted to clarify with Craig. So I loved your invitation to think about this particularly with the equity lens. So is that what we would be able to do when we get whatever communications coming, or is that something else that needs to be coordinated and arranged? Because there's a team. I know that Regional Health Commission is picking up the work and moving the equity structure piece forward. And so this might be something that they would definitely, I think this would be something that they would move on.
So this was Craig amplifying the voice of the director, the commissioner, and others whose lives kind of surround, all of our lives, at least in public health, surround equity. I don't think that's necessarily what everybody else is thinking. I don't think necessarily everybody else is thinking about this in broader terms. Perhaps the mayor is. I think it's going to require all the department directors, people in the community. You called out the Regional Health Commission and others to try to speak with one voice in terms of the importance and significance of putting St. Louis on the map as a place that is seen as even higher and better than Missouri in terms of its way of treating its people and setting the foundation for a more quality of life for everyone. So I think it's going to take lots of work by lots of people.
Other questions?
Hey, Craig, just a quick question. Do you have a sense of whether they're looking to get something on the ballot in 2024 for sure, or could this be further out?
Yeah, I do not know that. I suspect they may want to try to do it in 2024, but I don't know. They just started meeting. They've had 2 meetings. I by happenstance was going by the room on their first meeting and popped in. But I would encourage others to kind of pop in, and I think they do have the recordings online. I don't know that they made that decision yet when they want to put it on the ballot because they just started meeting. I suspect it'll be in 2024 though. I think you're right about that. The mayor's
Okay.
likely to want to try to do that. They may want to try to put it on, you know, as we launch into some of our national efforts and get people involved in the process. I don't know. That'll be a decision for them to make.
Okay, thanks, Craig.
Okay. I think we can wrap up this agenda item. As I mentioned, the Community Engagement Committee did not meet, but we're planning to schedule something for October. Our next meeting of the board will be October 19th. Are there any other announcements? If not, thanks everyone for your participation. The meeting is adjourned.